Seeing clearly is something we all want to do, but if you're suffering from age-related macular degeneration, it can be difficult, but there is help out there. Dr. Matthew Welch from Associated Retina Consultants is going to tell us more. Thanks so much for talking with us today.
Oh, I'm happy to be back.
Well, let's start with just daily activities for people who are suffering from macular degeneration. How does it affect them daily?
Well, so the thing you need to keep in mind about macular degeneration is it affects our central vision, not so much our peripheral vision. So the activities that it affects is mostly near work, reading, looking at things with fine detail. Even TV watching and driving can be affected by it.
You were talking about driving, that can be affected. Can people with macular degeneration drive or live alone, or what should we worry about?
So the short answer is in general, yes. I mean, of course, the devil is in the details, and on a case-by-case basis, it depends on to what level is their vision really compromised. But I encounter a lot of patients and family members that are concerned that mom and dad have now been diagnosed with macular degeneration. Do they need to sell their car? Do they need to sell their house? These kind of things. And it can be a very damaging disease, but it doesn't have to be. So it's a very specific to the person, to the patient, and not something that you need to think is ending your life.
Okay, so once you are diagnosed, what are the treatments? How can we get help?
So, the biggest thing is to receive comprehensive evaluation, to be seen, to have a dilated eye exam. Some people with early on disease have no symptoms at all, and so the American Academy of Ophthalmology recommends everyone over the age of 65 receive an annual eye exam. And then, depending upon your specific case, vitamin supplementation or other treatment modalities may be necessary.
Okay, what about cataract surgery? Is that an option for people?
So, cataract surgery and macular degeneration tend to be something that happens in the same age demographic, generally people over 65. And it used to be thought that there was a concern that cataract surgery either gave you macular degeneration or made your macular degeneration worse. Those have largely been disproven. And so cataract surgery is still something that's available for people with macular degeneration that often will still help them with their sight.
So that's good. So you're going to start with, of course, the exam. You're going to see if you have it, then start to get treatments. Are there any other ways to optimize our eyesight and our vision?
So the main thing with a person with macular degeneration is they now have to start thinking outside of just glasses alone. When you're 20, 30, 40 years old, maybe glasses alone will be all you need to optimize your vision. When you have macular degeneration, you have to start thinking about other things like lighting, magnification, the size of things that you're looking at. In this day and age with tablets, reading the newspaper on a tablet where you can increase the font size as opposed to just, the print paper is a real add to their visual abilities.
What about support groups?
So online, there's lots of resources, but local is really the best, right? So at Associated Retina Consultants, we have a monthly support group that meets that allows patients and their families, the opportunity to gather, share stories about shared experiences, to learn from one another what battling this chronic disease and condition can be like.
Yeah, and if you're interested in those support groups or you want to learn more or set an appointment to get your eyes examined, all you have to do is go online, associatedretinaconsultants.com, or call the number on your screen.